Welcome back to UC Davis Live. I'm Satirius Johnson. Please know that this episode of UC Davis Live will include discussion about domestic violence and firearm suicide during the pandemic. We are listing support resources in the comments section. COVID-19 has impacted our lives in many ways, alongside disruption of education and employment. Surveys have shown that surges in gun sales and increased reports of domestic violence. Has the pandemic also made society more violent? Well, joining us to discuss this question are two experts on violence in society. Claire Cannon is Assistant Professor of Community and Regional Development in the Department of Human Ecology at UC Davis. Her research covers the intersection of social inequality, health, and environmental justice. With colleagues at Tulane University, she's surveyed working people about their emotional and mental health during the pandemic. And Nicole Kravitz-Wirtz is a sociologist and epidemiologist and an assistant professor with the Violence Prevention Research Program in the UC Davis Department of Emergency Medicine. She's currently the lead investigator for the California Safety and Wellbeing Survey, an ongoing statewide survey on a wide range of topics related to firearm ownership and exposure to violence and its consequences in California. Thanks to you both for coming on today.
Thanks for having us.
Thanks.
So before we get started, I just wanted to remind viewers that this is a free webcast. You can watch it live and watch it after the live broadcast on the UC Davis Facebook, Twitter, and YouTube channels. We're aware of others posting links saying that you have to pay to watch the video. Please do not click on those links. This is a free webcast. And we are taking audience questions. So if you're watching us live, just leave them in the comments section and we'll work in as many as we can. So Nicole, you've surveyed Californians on their concerns about violence in the pandemic. What did you find?
Yeah, so really early on during the pandemic, there was a lot of anecdotal reports about increasing gun sales, but there wasn't much hard data. We began to sort of see and hear reports about increases in firearm background checks during the early months of the pandemic compared to the same time frame back in 2019. But those increases couldn't be directly tied to the pandemic per se. So to better quantify that process, we retooled our statewide survey research project, the California Safety and Wellbeing study, in order to directly ask our respondents whether they had acquired a firearm in response to the pandemic. And we did this back in July of 2020. So, 4 or 5 months into the stay-at-home orders and social distancing due to the pandemic. We weighted our respondents' answers to be statistically representative of California, and also so that we could extrapolate those estimates to the state. So in brief, after that extrapolation process, we found that an estimated 110,000 people reported having acquired a firearm in response to the pandemic, including roughly 2 in 5 of whom said they didn't already own a gun at the time.
So almost half of the people who bought guns during the pandemic hadn't owned one before.
Exactly, right.
So that's pretty startling. So what was it about the pandemic that made them feel they needed to buy a firearm?
Yeah, so most of these respondents cited a perceived need for self-protection corresponding with, for example, worry about lawlessness and prisoner releases, which was consistent with sort of the fear-mongering and the messaging advanced by some gun rights groups and others during that time. To be clear, though, the scientific evidence is really consistent. Easy access to an unsecured firearm in the home is associated with elevated risk for firearm injury and death for everyone residing in the home. And this is especially true when it comes to unintentional shootings and firearm suicide.
And have you found rises in those trends that correlate to what you just described as usual?
So we haven't looked at those outcomes specifically in response to the pandemic, but I think many folks, including some folks at the Violence Prevention Research Program here at Davis, are starting to gather the data to be able to look at these longer term trends. The one other thing on that point I will say that we looked at in the survey was changes in firearm storage practices related to the pandemic. And there we we found that roughly 50,000 current gun owners said that they had started storing at least one of their firearms in the least secure way, that is loaded and not locked up because of the pandemic. And if I recall correctly, nearly half of those households had children or teens residing in them. So again, that brings up sort of concerns about unintentional shooting and firearm suicide. As we know, we've seen increases over the past several years in child and adolescent suicide.
Right. So a lot of risk involved with doing that. So are these trends in, well, with the fear that the pandemic has brought amongst a lot of people, fear of crime, have you seen a reflection of that in reported crime rates? I mean, have crime rates gone up, and should people be, is it valid to have that fear?
I think we have seen some forms of at least violence increase, particularly community interpersonal gun violence has increased during the pandemic. Whether sort of firearms are the best response to sort of that, I think is maybe not where I would say. I think what we know about what works to prevent, especially interpersonal community gun violence, are things like investing in the communities where interpersonal gun violence is disproportionately happening, providing people with their basic needs, with living wage jobs, with sort of the support and that's really sort of what forms the foundation of kind of health and safety in the first place. So really focusing more upstream rather than on sort of the fear in the moment.
Right. So there may have been an uptick in some crimes, but having a loaded gun in a home with children is not the best way to try to counter that.
But yes, I think the research would support that.
What's the trend in firearm purchases? Are there certain kinds of firearms that people are buying? What's driving that trend?
Yeah, so generally when people are purchasing for these perceived needs around self-protection, we generally tend to see handguns purchased more often. And these are obviously sort of the ones that tend to be stored less securely than long guns.
Just a reminder, we are taking audience questions. So if you're watching us live, just leave them in the comments section and we'll work in as many as we can. Claire, turning to domestic violence specifically right now, what trends can we see there?
Yeah, so that's a great question. The World Health Organization just came out with a report a few days ago that was all over the news and social media that their data suggests one of intimate partner violence over their lifetime. And intimate partner violence is stalking, it's sexual violence, it's economic violence, it's physical abuse, it's emotional, it's psychological. So it's many different forms of violence. In the US, the CDC estimates that 1 in 4 women will experience some form of intimate partner violence in their lifetime, and that 1 in 5 men will experience some form of intimate partner violence. Specifically with the pandemic, we have seen escalating rates of domestic violence. And this started about a year ago when lockdowns went into effect globally. And that hasn't really abated. So we still see this kind of constant increased prevalence for domestic violence, both in the US and globally for the past year.
And is that attributed mostly because people are living with their abuser, or, people, maybe couples or family members who weren't abusive before the pandemic or under a stressful situation during lockdown?
Yeah, it's exactly. So some of our research with colleagues at Tulane University and University of Tennessee, Knoxville, with this data, we found that respondents who reported, renting, lost income due to COVID-19, increased additional stress, were all more likely to be in the intimate partner violence reporting group. So of those in our sample who reported intimate partner violence, those were contributing factors. And so some of the things that we talk about is that, when there's more to be stressed about, there's more to fight about. And if there's more to fight about, you're going to see more violence. Another aspect which you brought up, which is super important, is that people are trapped together. So people are isolated with their aggressors or their potential aggressors, right? And so, even being able to go out and take a walk or go meet with a friend and talk about your frustrations or your stresses, that's all been more or less cut off for most people. And so we see both the increase in stress, but we also see the decrease in resilience. And those are all contributing factors to increased intimate partner violence.
We do have a question from a viewer, Noel, who's watching on Facebook. Can either of you speak to the accuracy of reports about increased suicides amongst school-aged youth?
Sure. So I can maybe chime in first here. So over the past several years, we've seen sort of an increasing trend in suicide amongst 10 to 19-year-olds. And so it's a little hard to discern the direct relationship to the pandemic because we've been seeing this sort of increase already. So as we sort of retrospectively look back, I think there are maybe some ways that we can try and disentangle that, but there has been this ongoing trend in increased, at least firearm suicide amongst young people.
All the more reason not to have a loaded firearm in the house with children, right? I mean, it's one additional way that they can do something that they shouldn't be doing.
Absolutely.
So are school systems addressing this in any way that we know of, as far as trying to help youth who are stressed out and having depression and other stressful emotions because of the pandemic?
That's not my direct area of study. So I can't speak to it directly. I don't know, Claire, have you heard anything more generally about support for families broadly?
I haven't heard as much. I've heard that's part of the toll that's been taken is, when people are taken out of their communities, whether that's their educational community or their neighborhood, or even, colleges and universities, that we see, again, this increase in stress, this decrease in resilience. And so it's really hard to get resources. And then you add on top of that, our teachers, our mental health workers, our nurses, right? Everybody is kind of beyond capacity. And so you also see that contributing to just not having a lot of resources because it's, all that people can do to try to get their classes up and running. And so that's all created part of this crisis that we're living through, right? These are the kind of primary and secondary and tertiary problems associated with COVID.
So this new COVID relief bill that President Biden just signed today, are there any resources in that to try to help alleviate some of what we're seeing with violence and domestic violence?
So my understanding, and I have not gone through all 600 pages of the bill, admittedly, but my understanding is there are resources for schools, there are resources for universities, there are resources for states, which are really important because a lot of victim advocacy, a lot of victim support or survivor support, a lot of perpetrator interventions are funded at the local and state levels. And so as we reinvest in our states and our local communities, we can expect to see increased support and resources for these, doubly, triply impacted individuals.
Yeah, and I think that's exactly right. And similarly, I've only sort of read the top line sort of notes on the bill, but from what I've read, there are direct monetary support for families and families with kids that I think really will help to sort of reduce some of the psychological toll of worrying about, meeting basic needs that do in the long run or may contribute to some of the risk factors for violence generally. We've seen recently the findings, or at least the initial findings from the Stockton Basic Income Pilot were released. And, some of those similarly kind of top line findings show that when families are provided direct monetary sort of support, that many of the sort of psychosocial kind of outcomes that were examined improved. And so I think that has real implications for what we might see moving forward, given this new stimulus package.
Right. And let me just add, can I add, because I think this is a fantastic point that Nicole brings up. I mean, what we found in our study is that when people have increased financial stress, it increases violence in their relationships in the household. And so these tax credits for families, for individuals, for children, we expect to really alleviate a lot of the violence that's being experienced in families, in households. It's one of the first things that you can do, as Nicole's alluding to earlier, to help abate violence is living wage, investments in communities. These sorts of benefits are really, really important for reducing harm in our relationships, in our communities.
I think that's really important to know. I mean, that's a really great point, that we know that by decreasing that financial stress, you can reduce a lot of violence and domestic violence. So that's a really key finding.
Exactly.
What else? Oh, please go ahead.
No, I was just going to say, yeah, like just to sort of double down even further on this point, I think we sort of know sort of experientially and increasingly through research that the safest neighborhoods, the safest communities aren't necessarily those that have the greatest police or law enforcement presence. These are the ones, or the safest communities are the ones that have had resources invested in them, durable, sort of very intentional investments in the lives and the livelihoods of their residents. So I think the more that we can support things like we've already mentioned, those stable housing, affordable housing, living wage jobs, systems of support for mental health and well-being, that's where we're going to get the sort of the biggest bang for our buck when it comes to reducing and preventing violence.
All right. Have there been any studies that have come up with like a dollar figure per person or per child that basically says, okay, this is the level of support that's needed to reduce violence and domestic violence?
I'm not, I don't have a dollar figure offhand. I can't recall a study per se that's done that. One of the things though that we looked at in our California Safety and Wellbeing Survey was sort of several questions around how much people are willing to pay and or donate to reduce various types of violence in their communities by sort of, I think, I don't know, by a certain amount. We gave a certain amount. And so in our future analyses, one of the things we're interested in doing is sort of coming up with sort of a cost of violence estimate based on how much people are sort of willing to invest in reducing it.
We are taking audience questions. If you're watching us live, you can leave them in the comment section and we'll try to work in as many as we can. Claire, what are you looking at next as far as your study of domestic violence? What are you trying to either clarify from your findings that you've found so far, or what's next for you?
Great question. And Nicole, I love that research question where you all are headed. I think that's fantastic and will be really, really informative. For us, we have relaunched our survey. And so that's been open for about, I want to say 10 weeks. We're up to, I want to say maybe 900 total respondents now. And we're really interested. So the average number of days in lockdown for this research that we're talking about was 28 and a half days. And we're coming up on 365 days.
Right.
And so we fully expect that resilience is going to be, down in the dumps. We expect that stress is going to be sky high. And we expect that violence has both had an uptick, intimate partner violence is an uptick, and then it's kind of stayed there. And so that's kind of on the future for us, is really understanding after a year, what does resilience and stress look like? And what are the specific stressors that contribute to intimate partner violence? So that's something that's really important to us. Also, building off of this study, one of the things that we found was the importance of communication and communication resources. So one of the things that we put forward that research suggests, drawing on research about communication and intimate partner violence and disasters, other kinds of disasters, is to use the novel COVID public health infrastructure, which this American Rescue Plan has, really kind of turbocharged, and use that to get at questions of domestic violence. So one of the things that we recommend or suggest is increasingly when you go to your doctor's office, you get this question, do you feel safe at home? And depending on how you answer that question, so that might be familiar to some folks having been asked that, there's a series of follow-up questions to try to triage and connect people to resources. And what we suggest is that we can use the new COVID infrastructure around testing, vaccine, all of these sorts of things to ask similar kinds of questions, because we know that domestic violence is on the rise, people are isolated, and it's one of the few contact points that we have. And then by contacting people and communicating with them there, we can tap them into all of these resources that are already existing. And so we see this as another link in the chain to really help people get the care that they need.
So for somebody who's watching now who maybe is in a bad domestic situation or knows someone who is, what's the best way for them to reach out for help? I know we have some resources listed in the comments section here. What if they say haven't been to the doctor in over a year, what's the best course of action for them?
Yeah, so there are a couple of courses of action. I believe in the comments, there's the Domestic Violence National Hotline, which you can call at any point in time. In California, there's the California Victim Bureau, the VCB, which you can contact. They have a number of resources on their webpage and website. And then there's also the National Resource Center on Domestic Violence. So you can find them online as well. And this is for people who might be concerned about a loved one or a friend. This can be if you yourself are not sure if you're experiencing intimate partner violence or that you know that you are, and ways of getting support and care, both for survivors, potential survivors, as well as for aggressors and potential aggressors. Because a lot of our research shows that we're not going to combat the silent epidemic of intimate partner violence unless we also treat and reduce abuse and abusers.
Right. So if someone feels they're a victim of this, of domestic violence, domestic abuse, and they reach out to these resources, they feel secure in the knowledge that they will be able to kind of be extricated and not be, hounded by their aggressor?
Yeah, so this is a really great point, and it's a really complicated answer. So a number of these resources, particularly the Domestic Violence National Hotline and the National Resource Center on Domestic Violence, you get a splash screen that says, people can trace your web history, right? Make sure that you're logging in from a safe place, because it's really important to think about all of the things that we share in an intimate partner relationship, including our computers or access to those computers or cell phones. And so that's something to be aware of right off the bat. Of thinking about how to contact and access these resources in a safe way. Once contacted and accessed, we know that there are lots of victim advocacy and support channels and centers and resources. As I mentioned, a lot of those will be local. So the national organizations can put you in touch with local shelters and agencies and advocacy, as well as with different kinds of mental health treatment to help deal with the trauma and abuse that comes from these relationships. In terms of building on that, there are safe ways to extricate people. We do know that it can be really difficult to leave an abusive relationship for many reasons. Everything from, emotional and mental kind of well-being and identity formation, to financial reasons, to reasons of family and children and households. So there are multiple intersecting and scalar aspects that go on with these kinds of decisions. And these support groups and advocacy groups can really help people navigate all of those concerns and those relationships. These are highly trained, oftentimes highly trained individuals, social workers, psychologists, who can help kind of assess and negotiate and figure out the best path forward.
That's great to hear.
And can I just sort of add on that to sort of the great and very sort of comprehensive response that Claire had to this, very multifaceted sort of issue. I will just say at the sort of the policy level, if there's firearms potentially involved in an abusive relationship, California has what's called a gun violence restraining order policy, which enables household members or law enforcement to proactively restrict access to existing firearms or the purchase of new firearms by individuals whom a judge has deemed to be at increased risk of firearm-related harm to not only oneself, but also then potentially to others. And so that, if the involvement of the criminal legal system isn't always the right route for everybody, but just throwing that out there as an additional potential tool for the toolbox.
That's great. Rhonda, who's watching on Facebook, is asking, can you speak to the expected impact of the new Recovery Act on violence in children and families, reduction of economic stresses? I know, we haven't read all 600 pages, but she says we covered some of this earlier in the program, but for those of us just joining, maybe we can dig in a little more. So are there any kind of specifics, or maybe we can just recap what we had mentioned before about the Recovery Act?
So I can start again, and I think just sort of the overarching sort of point here, I think, is that we know that when people's basic needs are met, they tend to be safer themselves, and their communities tend to be safer. So if we can support families through the COVID relief direct checks, through the expanded child tax credit, which I think they're also allowing to come on sort of a monthly basis instead of only once a year at tax time. I think these are really important sort of and potentially critical preventative measures when it comes to not only family violence, but also then interpersonal kind of community violence as well.
Yeah, I think that's a great summation and addition. And the only thing I would add is that, our research shows that financial stress is a leading cause and contributor to intimate partner violence, both during disasters and not during disasters, and certainly during COVID-19. And so the more that we can support children, the more we can support families, the better off they'll be. Some of our previous research has shown that children, every additional child in a family can cause additional stress on a relationship, leading to instances of intimate partner violence. And so the more that we can kind of get back and support these families, the reduction in household violence that we'll see. And the other thing I just want to add related to our conversation is that about 15% of all homicide victims are killed by an intimate partner. Right. So this is the real intersection of Nicole's fantastic work on gun violence and intimate partner violence, that this is a crisis for our families and communities that's going on all the time, that's been further exacerbated by COVID. And what I always tell my students, call me an optimist, is that when we have these really challenging problems that feel really big in scope, that means that there are really big opportunities. And the American Rescue Plan is trying to take advantage of that, as we have both entrenched inequality and violence in this society, and we have exacerbated inequality and violence due to COVID. And this is a real opportunity to battle both of those.
Yeah, and I'll just add, so that's I think perfect, right on point. Is I would be remiss if I didn't sort of acknowledge that some of our kind of immigrant workers, tax-paying immigrant workers, are explicitly excluded from this relief package. And so until we can sort of include all of our community members, especially, many of whom are, part of our essential workforce here during the pandemic, in relief packages like this, I think we're missing a real opportunity, as Claire was saying, to expand and bring in and broaden our preventative of options. We know from other work from colleagues across the country that interpersonal gun violence and inequalities in interpersonal gun violence are linked to greater income inequality, to residential segregation, to housing insecurity and hunger and unemployment. So when we can address those for everyone, especially those who are more likely to live in minoritized and marginalized communities, the better we will be in terms of preventing and reducing violence.
Well, this has been a really great conversation, very eye-opening. Thank you so much for coming on today and sharing your work.
Thanks for having us. This has been a blast.
Yeah, it's fun.
Claire Cannon is Assistant Professor of Community and Regional Development in the Department of Human Ecology at UC Davis. Nicole Kravitz-Wirtz is a sociologist and epidemiologist and an assistant professor with the Violence Prevention Research Program in the UC Davis Department of Emergency Medicine. On the next UC Davis Live, how UC Davis and the City of Davis are partnering to prevent the spread of COVID-19 and keep the entire community as healthy as possible. Until next time, I'm Satirius Johnson, and this is UC Davis Live, COVID-19.